What's up, you guys? It's Larry Dougherty. I'm a dentist here in Garden Ridge, Texas. I'm in Park Lane Park right now in Garden Ridge. Great little place to hang out. Anyway, I've been obsessed, at least the last year, with effective communication, especially as it relates to dentistry and communicating with the dental team and dental patients. At one of my very first jobs, the doctor I worked for, Woody Domingos in St. Augustine Beach, Florida, great mentor, he had invested in some training with Jay Geyer from the Scheduling Institute. And at that time, the Scheduling Institute, I don't know what it consisted of at the time, but there were some training videos, some audio, and I took a look at it and I got obsessed with it, and I watched it and listened to it more than 10 times, and I got really good at all the stuff that Jay was teaching at the time, the dual alternative close, which I think is still a big part of what he talks about, just creating opportunity for success, communicating with people so that they can get what they're looking for, and making it easy for people to come in, to schedule, to become part of a practice. And so much of the language skills that I got from the couple hours of training that were in those videos and then those audio clips that I listened to over and over again set the foundation for how I built my practice. And I've used those principles to teach people for years now. So much of communicating effectively on the phone, communicating effectively at the beginning of a new patient visit, it's so important to setting the tone and to gaining trust with patients. All of the visual tools, all of the software, everything that we use in the practice is centered around creating effective communication to patients so they can understand what we're trying to tell them. A big project that we've taken on in recent months is streamlining and rewriting and making all of our post-operative instructions more effective, so that communication that we're putting out to patients is exactly what we want to say and as clearly and concisely communicated as possible. And we've gone to great lengths to make sure all of it makes sense, that it's readable, that it's understandable, and we've even videotaped it so that does anyone say videotape anymore? We've even videoed it so that we can have patients watch a video of it to make the communication more effective. Communicating to patients about what to expect is extremely difficult. We get so deep into the world of dentistry and the technical aspects of what we're trying to do, because dentistry is very technical and very complex, and communicating it to patients who are half listening, who are nervous, who are scared, all those things is difficult, and it takes time and it takes practice, and it takes really a lot of self-assessment on our part as the dentist and the dentist team to really be honest about whether or not what we're doing and saying is effective. Equally important is the communication that we have amongst ourselves on the team. So for instance, I hate sticky notes. I got rid of sticky notes. I don't like to see sticky notes. It's just not a great way to communicate. A lot of our communication inside the office is on software, on the computer, on checklists on the computer, so we can go back and search chats about things regarding patients or projects that we're working on in the office so that things don't get lost, so things don't get left behind, so it's not about sticky notes. That effective communication amongst ourselves allows us to provide a level of care, I think, that's superior than if we weren't doing that. We can really take on bigger things by communicating effectively. I learned a trick from my lab technician, Nelson Rigo at Smiles by Rigo in California. Sometimes when he needs to show me something, he just videos himself talking and showing me what I need to see and sending me a video. And I started doing this with some of my colleagues to share information more effectively, and they were all blown away by the idea. And I'm like, I know I got this idea from my lab tech. He's awesome. It's just everything we can do to communicate more effectively with each other is something that we latch onto, and we leave the sticky notes behind, the emails, the faxes, all that stuff behind, because it's just not 2024 dental communication. There's so many better alternatives out there. Along those same lines too, effective communication is just communicating back to ourselves, holding ourselves accountable to what we say we're going to do. And a lot of that comes from checklists. I've probably ranted in other videos about the checklist manifesto, but I'm really big fan of checklists. I use checklists for every single procedure that I do, and every time we finish a procedure, we go back and look at the checklist to make sure that we followed it while we're doing it. But sometimes in the middle of a procedure, we'll look at the checklist, we'll realize that maybe the sequence of something needs to be flipped around, or there's a step that, there's something that we should never forget that we need to put back in this checklist. So we'll rewrite write the checklist, and there's a lot of procedures that we edit the checklist almost every time we do it until we get it right, until we get it perfected. It's important that we do that to get better each and every time we do a procedure. And of course, there's some procedures that we've got them really dialed in and we haven't had to change the checklist in a while. So that's great that we've got something where it needs to be. There's so many things in dentistry that really get down to like following your own rules and following the cookbook. So you learn the rules, you follow them. You learn the cookbook recipe, you write it down, you follow the recipe. There's so many mistakes that can be avoided just by doing that. I mean, it doesn't have to be that complicated sometimes. There was a great spear video several years ago that Dr. Jeff Rouse did where he said something like that. Just follow the rules. Just read the instructions that come with the package for the thing that you're doing and follow those rules. I took that to heart so much and made sure that all of the instructions that for all the products that we used, all the things we did, we were following the rules right down to there's timers in every operatory where we're, something, if you're supposed to do something for 15 seconds, we do it for 15 seconds. If we're supposed to wait 5 minutes, we wait 5 minutes. We don't leave anything to chance that says specifically not to leave this to chance.